Your doctor checks your blood pressure, your cholesterol, maybe your resting heart rate, and then they send you home. But there is one part of your body that none of them are looking at closely enough: your fingernails. Right now, at the end of your hands, they have been recording your cardiovascular health every single day of your life. According to the American Heart Association's 2025 statistics update, cardiovascular disease claims nearly 950,000 lives in the United States every year, making it the leading cause of death worldwide. What is most alarming is a trend confirmed in the 2024 AHA review. After decades of declining rates, cardiovascular disease burden has reversed course and is climbing again. The window for early detection has never been more critical, and the signs are already visible to anyone who knows how to look. Today, I am going to show you 6 things written on your fingernails right now. First, a pale frosted pattern that has an odds ratio over 6 for coronary artery disease. Second, a half and half color split that signals the heart has been under sustained pressure for months. Third, invisible lines your fingertip cannot feel but your eyes can see. Fourth, grooves that record a cardiac event you may not even remember having. Fifth, dark vertical lines that could mean your heart valves are under bacterial attack right now. And sixth, a self-test you can perform in under 1 minute that measures your stroke risk directly. The first sign is called Terry's nails. The entire nail surface turns an opaque, frosted white with one defining detail at the tip: a narrow strip of reddish or pink color, a few millimeters wide, running along the far edge of the nail. That strip is the marker that separates Terry's nails from ordinary pale nails, and it is the detail most people miss. A peer-reviewed study published in the Journal of Experimental and Clinical Medicine examined 103 patients across 6 months and found that the presence of Terry's nails carried an odds ratio of 6.25 for coronary artery disease and over 5 for diabetes mellitus. Research published in the Indian Journal of Dermatology confirms that Terry's nails reflect a reduction in blood flow through the subcapillary plexus beneath the nail, caused by excessive connective tissue growth between the nail plate and the underlying bone. When the heart is struggling to maintain pressure through the smallest vessels, those capillaries beneath your nail bed are among the first to show it. The nails turn pale. The tip retains color because a residual cluster of tiny vessels called telangiectasias survives there longest. This change does not happen overnight. It builds over months, which is exactly why it is so dangerous. The body compensates quietly, and the nails record the compensation silently. Hold your hand up in natural daylight right now. Look at each fingernail one at a time. Check the overall color, and check the tip. The second sign is called Lindsay's nails, sometimes called half and half nails. The nail is cleanly divided into 2 zones separated by a sharp horizontal line. The half closest to your cuticle is white or pale. The half closest to the tip is a brownish-red color. The dividing line is usually clear and distinct. Research associates Lindsay's nails with heart failure and liver cirrhosis, and with sustained circulatory stress over time. The mechanism is similar to Terry's nails, but with a different vascular pattern in the nail bed. When blood pressure through the digital capillaries is chronically reduced, the proximal nail bed loses its normal pink color entirely, while the distal end retains a darker hue from a different vascular plexus. According to a clinical review published in the Journal of General Internal Medicine, both Terry's nails and Lindsay's nails belong to a class of nail findings called apparent leukonychia, conditions where color abnormality originates not in the nail plate itself, but in the blood vessels directly beneath it. This distinction matters because it means what you are looking at is a live vascular signal, not a cosmetic artifact. You can check for both Terry's nails and Lindsay's nails in under 30 seconds using natural light. The third sign is called Muirca's lines. These are multiple horizontal white bands running parallel to the base of the nail, parallel to the small crescent called the lunula. You can see them clearly, but when you run your fingertip across the nail surface, you feel nothing. They do not move with nail growth. If you press on the nail, they disappear and return when you release the pressure. That is because they exist in the vascular bed beneath the nail plate, not in the nail tissue itself. Dr. Robert Muirkey first described these lines in a 1956 paper published in the British Medical Journal. He identified that the lines appeared exclusively in patients with serum albumin levels below 2.2 grams per deciliter, a clinical threshold for hypoalbuminemia. Research published by StatPearls via the National Institutes of Health confirms that Muirkey's lines reflect localized edema in the nail bed that compresses the surrounding capillaries, preventing the normal pink color from showing through. Low albumin is a marker of sustained metabolic and circulatory stress. When the heart is not pumping efficiently, fluid distribution throughout the body shifts. Tissues become congested, albumin falls, and the nail bed records it as white lines you can see but cannot touch. The study from the Journal of Experimental and Clinical Medicine found Muirkey's lines to be a statistically significant predictor of heart failure with an odds ratio approaching 6. The fourth sign is called Bowes lines. Unlike the previous three, Bowes lines do not reflect chronic gradual change. They record a specific event. They appear as horizontal grooves or depressions running across the nail plate, indentations you can both see and feel. They form because the nail matrix, the zone of cells beneath the base of your nail that produces new nail tissue, temporarily halts its activity during a major physiological shock. A heart attack, cardiac surgery, severe systemic infection, or any prolonged critical illness can trigger this pause. When growth resumes, the pause leaves a physical groove embedded in the nail. Because fingernails grow at a rate of approximately 3 millimeters per month, you can estimate when the event occurred by measuring how far the groove sits from the base of the nail. Bowes lines appearing across multiple nails simultaneously indicate a systemic event rather than a local one. According to Healthline and clinical literature reviewed through the Mayo Clinic, Bowes lines associated with cardiac events have been documented following both recognized and silent myocardial infarctions, silent heart attacks, in which the patient experiences no classic symptoms or attributes the episode to flu or unusual fatigue, are estimated to account for roughly 45% of all myocardial infarctions according to data from the American College of Cardiology. If you find a groove across most of your fingernails and cannot connect it to a known illness, that warrants a direct conversation with your doctor. The fifth sign is called splinter hemorrhages. They look exactly as the name describes, tiny dark red or brown lines running vertically beneath the nail surface, pointing from base toward tip. They are not in the nail plate. They are under it. They are small clusters of blood trapped in ruptured nail bed capillaries. A single splinter hemorrhage following trauma is not significant. Multiple unexplained splinter hemorrhages appearing across several fingers at the same time is a different situation entirely. According to the CDC and clinical sources including StatPearls, splinter hemorrhages appearing without trauma are classically associated with infective endocarditis, a bacterial infection of the inner lining of the heart chambers and valves. The mechanism is specific. Bacteria that have colonized a heart valve shed tiny infected clots called septic emboli into the bloodstream. Those emboli travel to distant small vessels, including the capillaries beneath your fingernails where they lodge and rupture. The result is the dark vertical lines you can see beneath the nail surface. Infective endocarditis is a condition that deteriorates rapidly without treatment. The presence of multiple unexplained splinter hemorrhages, alongside any other symptom, even something as vague as low-grade fever or unusual fatigue, warrants same-week medical evaluation. Now I want to teach you something you can do with your hands alone, right now, in the next 60 seconds. It is called the capillary refill test, and it directly measures how quickly your smallest blood vessels recover from pressure, which is a direct proxy for cardiac output and microvascular circulation. Hold one hand at the level of your heart. Use the thumb of your opposite hand to press firmly on one of your fingernails for 2 full seconds. Watch the nail bed go pale as the blood is pushed out. Then release and count quietly. In a healthy adult, the pink color returns in under 2 seconds. According to StatPearls and clinical guidelines reviewed by the National Institutes of Health, A capillary refill time of 3 seconds or more, consistently across 3 or 4 fingers on both hands, in a warm room with warm hands, is a meaningful indicator of compromised microvascular circulation. Research links persistent, slow capillary refill in older adults to reduced cardiac output and to undiagnosed atrial fibrillation. The CDC reports that atrial fibrillation is associated with a 5-fold increase in ischemic stroke risk and is responsible for approximately 1 in 7 strokes in the United States. Among adults over 80, atrial fibrillation accounts for 36% of all ischemic strokes, according to data from the European Society of Cardiology. Many people with atrial fibrillation have no recognizable symptoms. Their first indication is a stroke. The capillary refill test takes 60 seconds. Do it now. Here is what I want you to take from everything we have covered. Your nails are not decorative. They are diagnostic. The capillaries that feed them are the smallest blood vessels in your body, the first to reflect stress when your cardiovascular system is struggling, and the ones your doctor almost never has time to examine carefully. You do not need any equipment. You do not need a clinic. You need a window with natural light, 2 hands, and 60 seconds. Check your nail color for the frosted white of Terry's nails. Check for the 2-tone split of Lindsay's nails. Look for horizontal white bands you can see but not feel. Look for any grooves running across the nail plate. Check beneath each nail for unexplained dark vertical lines. And do the capillary refill test on at least 3 fingers. Write down what you find today and photograph your hands in natural light. Compare that photograph in 6 months. If you find one of these signs, mention it at your next routine appointment. If you find 2 or more together, do not wait for your annual checkup. Call your doctor's office this week. Your nails have been at the end of your fingers every single day of your life. They have been keeping records while everyone else was looking elsewhere. You now know how to read them. Share this with someone you love, because the most important cardiovascular exam they will ever have might not happen in a clinic. It might happen tonight, at a window, in the light. Now watch the video right next to this one where I show you the 5 things your tongue reveals about your heart, because what is happening inside your mouth right now may be just as important as everything we covered today.